Brownfields and land reuse sites are areas that may be contaminated with toxic substances and are selected for redevelopment. They range in size from mom-and-pop grocery stores to abandoned industrial complexes. Because these sites are scattered about residential areas, communities can be affected in multiple ways. Lower property values, a diminished tax base, increased crime rates, decreased access to healthy foods, and limited access to health care are some of the issues associated with brownfields and land reuse sites. The Agency for Toxic Substances and Disease Registry's Brownfields Land Reuse Health Initiative helps people understand what a brownfield is and how it can affect the health of the community. We work with communities to protect their health when redeveloping brownfields and land reuse sites. We encourage communities to include and promote community health in brownfield and land reuse projects by following these simple steps. Include the community. Evaluate environmental and health issues. Communicate risk or broader health issues to the community. Redesign with health in mind. And measure success of environmental and health changes. Limited access to health care is a common issue in communities with multiple brownfields. The North Greenwood neighborhood of Clearwater, Florida was once started with toxic brownfields and in desperate need of health services until retired nurse Willa Carson stepped in to fill the need. She opened a free community clinic in 2 refurbished apartments. It was staffed by volunteer doctors and nurses and provided free, quality health care to the uninsured and underserved. Willa Carson's vision is now a reality and is a model for cities around the country. In the Dream is Possible, Brownfields to Healthfields video, communities show other communities how they can improve access to health and healthcare through redevelopment. The East Tampa community will discuss the resources they used to have a positive impact on the health of their community by utilizing EPA brownfields and federal stimulus funding to obtain the land, partnering with the Health Resources and Services Administration to obtain funding to build from the ground up, and by utilizing the National Health Service Corps to provide qualified medical staff.
Well, we're here in Tampa, Florida, and Tampa is unique in the fact that they've been in the Brownfield program for over 10 years, and they have a real concerted effort to address health and health care. They've used all different types of resources and partnerships to do things like provide 2 federally qualified health centers within their community. And that started with community outreach at a Brownfield meeting in 2007. And they've come a long way with 2 new healthcare facilities. Additionally, they've taken brownfield sites and provided areas for education and community meeting to address recreation and provide a healthy place for people to exercise. And they're also seeking to put healthy foods in a food desert area. Now we're going to talk to Ed Johnson, who's the director of the East Tampa Community Redevelopment Agency, and he'll talk about their Brownfield program.
The Brownfield program is making a tremendous impact on this particular community of East Tampa, in that the community established a needs assessment back in 1992 that kind of highlighted several of the important things that were necessary for them to understand how their community could be redevelopment. And based on that needs assessment, information came out that this community was in desperate need of health clinics to be able to care for our indigent population. Prior to the Tampa Family Health Centers opening their doors and being able to go after federal funds to be able to service this indigent care community, folks were just left to fend for themselves. And the Tampa Family Health Centers decided that it needed to do more. The need was identified for many, many years, and it's because of our federal dollars through the Brownfield program and also through the federal stimulus programs that we were able to acquire enough funding to be able to build the new centers that you'll see later today. And I would really like to take you along with me for a little ride up to Tampa Family Health Centers at Osborne and 22nd Street, where you'll be able to see one of these jewels in our community, to be able to see how they operate and possibly talk to some of the doctors that are working in this facility. So if you would like to come along, I'd be glad to take you up and show you our wonderful facility.
We opened this center in November of 2010. It was originally 5 homes and a vacant lot. We purchased this as a block and built this center from the ground up. This center has 29 exam rooms in it. We do medical and we do dental, and we have a full-service pharmacy. Our dental has 10 operatives and 2 dentists. We have a total of 8 providers at this location, and our staff is about 53 employees right now. This center provides services to the residents of the East Tampa area. That comprises approximately 37,000 people. And the patients that we see at this location generally fall into the medically underserved category. That's that group that's 200% or below of the poverty level. And if it weren't for us, they'd be going to Tampa General Emergency Room, Florida Hospital Emergency Room, St. Joseph's Emergency Room. So we serve as their real only source of medical care in this area. HRSA, which is the Health Resources Services Administration, has been critical to our success in Tampa. Over the years, we've received several grants from them, and these grants have allowed us to, in the case of this center, build it from the ground up. We've built other centers with grants from HRSA. Tampa Family Health Center's mission statement is that we provide quality, accessible health care to a culturally diverse community. We do that with our 12 health centers and our dental centers and our pharmacies. I don't believe that many thousands of people in the Tampa area would have any place to go if it were not for the Tampa Family Health Centers, and the assistance that we've gotten through HRSA has been critical in making this and helping us to meet our mission. The ways that HRSA has helped us in addition to the grants are, they are the suppliers of the National Health Service Corps loan repayment and scholar providers. We are eligible for placement of NHSC scholars and NHSC loan repayment. They come in and they work for a period of time, and they either work off their student loans or they work out an obligation they incurred when the government paid some of their tuition up front. So without HRSA and the loan repayment, we would have a much more difficult time staffing our providers at these centers.
That program is a federal program where medical students who think they want to work with the underserved in underserved areas sign up to become a primary care physician, and they basically pay back the time that they're paid to go to med school in a federally qualified program where they can actually work with the communities that they want to work with. So for example, I was helped financially for 4 years when I went to medical school, and I wanted to work with the underserved, and I am working here doing that. So this is my 3rd year. Essentially, being a primary care doctor in an area that is underserved means that you have to look at what patients come in for. If they're in an area where there's no primary care physicians, usually the main medical problems, diabetes, hypertension, cholesterol, things that they would get help with in a basic clinic, we provide. We all the providers here and in other health centers like this wish we could do more. The little that we do every day is okay, but I think we could definitely do more.
This is the first of a series of videos on access to health and healthcare through brownfield redevelopment. And we're very hopeful that communities throughout the country will look at the examples, and when they go by brownfield sites in their community, could be contaminated gas station sites, could be dry cleaners, junkyards, or industrial facilities, they'll look at those in a health focus and a health lens. We hope that this will provide a tremendous opportunity for your community to use the resources we've talked about to truly have a positive impact on the health of your community.